All right, welcome back. This patient travels to Florida from sunny California. She has horrible pain in her neck. She's developing what we call a chin-on-chest deformity, where her head is sagging down. She's having trouble picking it up. She's having trouble turning to the left. Why? Simply because she has pain coming from her facet joints. And we're going to try to fix that for her today. That's our goal. Left-sided pain in the facet joints. We're going to start with the top of the spine, number C3, and we're going to work our way down. Sean? I've got to be exactly in the right spot, which is where the medial branch of the dorsal ramus wraps around the side of the spine, coming around from the neuroforamen, around the lateral mass between the facet joint. That nerve, if you look exactly on the x-ray, Jordan, show them with the arrow. You see the tip of my probe? That's exactly where the nerve comes from, lateral to medial, from the side towards the middle, and innervates the facet joints. It is a pain nerve. All it does is bring pain. It does nothing else. It has no good function except tell you that your facets are hurting. And we already know that. So lots of people suffer with this condition, and many doctors treat it, but nobody cures it until now. We now have pioneered the cure. The cure is go in and permanently cut the pain nerve. Many doctors do a temporary cut called a RHIZOTOmy or RFA, radio frequency ablation, where they go in and place a needle that just tries to burn and destroy that pain nerve. Unfortunately, it does not work, and patients have to keep coming back over and over again for more treatment. Our treatment is permanent. Henry, let's show the audience what I'm talking about.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. I just want to compliment my team here in the operating room for an amazing job. Not an easy case. We had to fix 3 discs, 2 SI joints, 2 piriformis muscles, and her cervical facet. And Dr. Patel also did the Duke plasma rhizotomy for occipital neuralgia for pain shooting up above her ear. Dr. Berndes did an amazing job. of keeping the blood pressure perfect the whole case. And the patient's going to be rewarded with a great result. So I'm very happy. She came from California. She's going to go back to California, hopefully with a great experience. Thanks for joining us, and we'll be back in 45 minutes or so for the next surgery. Dr. Duke Mayton here at the Duke Spine Institute with a patient who traveled here from Colorado with her husband, and she underwent the cervical Duke laser disc repair for 2 herniated discs in her neck. And how are you feeling today?
Great. Even on the way home, I felt all the pain release from my arms and my shoulders. I didn't realize how much pain I was actually in. So my arms just feel light. And sitting in the waiting room here earlier, I realized my neck is not hurting at all and my headache is gone.
So your headaches are gone, your neck pain's gone, and your arms are starting to feel normal again.
Yeah, yes.
Amazing, isn't it?
Yes, so amazing. I'm so grateful.
Yeah. Tell me what life was like for you before you came to Duke Spine Institute.
We have 4 small children, and it was very hard because we homeschool. My oldest started taking over laundry. I couldn't get in to the washer to get the clothes out. He has to help a lot with the little ones with school. I was in bed a lot with pain, and laying down hurt, so then I would sit up in the recliner, and I wasn't sleeping at all. Last night, I slept.
Congratulations. Now, are you feeling good here today because we gave you lots of pain medicines, or are you on any pain med at all?
No, I didn't even take ibuprofen. I think in the IV there was Tylenol. I didn't even take the muscle relaxer, no pain meds.
Yeah, the pain meds from surgery wore off yesterday.
Yeah.
And today your body has no pain meds and you have no pain.
No pain.
Congratulations.
Thank you.
Now, it must be hard with such a severe, debilitating neck and pain and headaches when you have kids, because, you know, your whole life is all about having kids and bringing them up and engaging with them and being part of their life. And when you have pain like that, it takes your time away from your kids. It takes your quality of life away. So you had to do something about this.
Yeah.
And did you have any treatment in Colorado?
They wanted me to do an epidural in the neck because there was no room in the spinal cord. That made it worse because the fluid had nowhere to go. So I did that, and then the surgeon in Colorado wanted me to do a fusion and basically laughed when I asked if there was other options. So that's when it led us to do more research and watch all of his videos, and I just knew in my gut this is where we had to come.
Yeah, you're right. I'm glad you did not choose the fusion, but why did you not choose the fusion? What were you worried about?
I was worried that I have 4 young children, and if I do a fusion, it would be worse, and then it would just keep continuing all the next discs. And I was really having like a claustrophobic feeling of I won't have any movement. I'll lose my mobility if I do a fusion.
And with the Duke laser disc repair, you can see we went in with a 4mm incision. There was no bleeding. There was no hospitalization. She was asleep for an hour while we did her procedure, and you basically woke up pain-free.
Yes, I was actually very emotional when I woke up because I was like, our whole family needs to come here. All of our parents are in pain, so this is where you need to come.
We'll take good care of them here. Well, share with the audience watching what life is going to be like for you now and anything you want to tell the audience.
I feel like when you're in chronic pain for so long, you start to have anxiety, have maybe a little bit of depression, and all of that has completely lifted. And I think doctors will be like, oh, you're just depressed, take this medicine. But that's not what it is. It's the pain, the chronic pain. So I know that my quality of life will be much better now. My 2 boys play hockey, and there were so many times I couldn't sit in the stands. So it's really exciting.
Congratulations.
So, yeah.
All right. Well,
Thank
enjoy your
you.
life with your family.
Yes, thank
All right.
you.
Let's get